I'm Dr. Eric, urologic surgeon and men's health expert. Let's talk about masturbation. We'll cover some of the common myths surrounding masturbation, as well as why it may be good for you and why it may not be. Myth number 1. It's a guy thing. It's not. While 90% of men report masturbating on a regular basis, so do 70% of women. There's good reason for this. Masturbation, of course, can produce pleasure, but has also been reported to improve mood, sleep, focus, stress levels, and concentration. It can even improve self-esteem and body image. The hormones, including dopamine, serotonin, and endorphins, released during orgasm, are what we think produce these effects. Number 2, people in relationships don't masturbate. As we just talked about, this simply isn't true. People masturbate when they're single or when they're in relationships. Some masturbate separately, some together. Either way, masturbation within a relationship doesn't reflect on the happiness within that relationship. Myth number 3, it causes erectile dysfunction. Masturbation does not cause erectile dysfunction. It is important, though, to recognize that it can impact your sexual performance in a few ways. There is something called erectile latency, which is basically the amount of time it takes from sexual completion for your body's ability to achieve another erection. This amount of time increases with age, so it's possible that if you masturbate too close in time to a sexual encounter, that you may have difficulty getting an erection. The other way that masturbation can impact erectile function is if you masturbate in a way that decreases your sexual pleasure from a typical sexual encounter. What I really mean by this is that if your technique of masturbation is unusual, then you may not get a similar sensation when you're with a partner. You might then find that you are subsequently less aroused when you're with a partner. Myth number 4. It's not a normal part of sexual development. A study published in 2011 revealed that between the ages of 14 and 17, 74% of boys and 48% of girls masturbate. It is totally healthy for people of all ages to masturbate. And most importantly, it's safe, and it helps you better understand your body and your sexual desires. And of course, it avoids unwanted pregnancies and spread of sexually transmitted diseases. Myth number 5, you can masturbate too much. When done in a healthy way, there's really no such thing as too much masturbation. It's only a problem when it becomes a compulsive act that disrupts relationships, or if it starts to replace real-life experiences or gets in the way of your daily activities. If that happens, you should cut back, and ultimately you may benefit from therapy. Myth number 6, masturbation will make you blind. Obviously and categorically, this is false. Otherwise, 90% of men would be blind, and so would 70% of women. This myth stems from religious conservative views that sex and sexual pleasure is strictly for having children. This, of course, is not true. The truth. Masturbation is a healthy way to relieve sexual tension and to have a pleasurable experience. There are no health risks to masturbation. There can even be benefits, as we discussed before. There's even evidence that masturbation can help to reduce the risk of prostate cancer in men. Hopefully, this video has helped you to better understand the truth around masturbation, and that it is a normal and healthy part of life. Please click the subscribe button to stay up to date on my health videos and leave any questions in the comments section below.